Okay, thank you, Lorenzo, and thank you for this invitation. And when I received the the invitation, I thought which topic to cover, and I thought it could be nice to go through some books which were important to me during my career, both on the personal and on the professional point of view. And let's start with the first book. In 1955, an article came out in the British Medical Journal, Uses of Epidemiology, by Jerry Morris. And 2 years later, in 1957, the book came out, and this is the first edition, and this is the third edition from 1974 or 75, which is the one I actually read. And Jerry Morris was a great man and a great epidemiologist. He was born in Liverpool in 1910 and from a Jewish family that just emigrated recently to escape pogroms in Poland by boat, and the family adopted the surname of the ship's captain, which was Morris. And his family moved to Glasgow, where Jerry was brought up in extreme poverty and undernutrition. Even in the last days of his life, during the summer, it was possible to see him with the signs of rickets that he had in infancy. And in his childhood experience of Glasgow slums, that informed his later work and led to his membership of the Labour Party, which he joined at the age of 16. He was also a political activist and only left in his 90s in disgust at the Second Gulf War. He was, since the 30s, an early proponent of social determinants of health, and in 1948, he founded the social medicine unit at MRC, and he served in early committees on smoking, air pollution, and in the Black Committee on Inequalities in Health. In 1967, he launched the Master of Science in Social Medicine, a joint venture by the London School of Hygiene and Tropical Medicine and the London School of Economics. And I think it is correct to say that it is universally recognized that his 1957 book, Uses of Epidemiology, influenced public health education and the development of prevention strategies for the control of non-communicable diseases in UK and throughout much of the world. Now, let's see which uses, there are 7 of them, of epidemiology he proposed, first in the article and then in the book. The first was an historical study of the health of the community and of the rise and fall of diseases in the population. And you do this by studying trends, and we can make out of the trends useful projections into the future. And this, he stressed, had a strong implication for prevention. Then community diagnosis, to study the distribution of health and disease among the population and the dimension of these in incidence, prevalence, mortality. And understanding, but he stressed very strongly that to do this, it was important to understand the social, cultural, and environmental characteristics of the community. Then the working of health services and the fact that epidemiological information should provide the basis for planning, developing, and evaluating the needed health services. And this was 17 years before Archie Cochrane's book on random reflections on health services. To estimate from the population experience individual chances and risk of diseases, quantifying the degree of risk and absolute and relative measures of risk. To complete the clinical picture by observing secular changes in the character of diseases and its pictures in other countries, so temporal and spatial approach in epidemiological studies. In identifying syndrome from the distribution of clinical phenomena among sections of the populations, an introduction to clinical epidemiology and stratification. And the 7th was about causality, use in the search of causes of health and disease, starting with the discovery of groups with high and low rates, studying these differences in relation to differences in way of living, testing these notions in actual practices among populations, which again probably anticipated some of Archie Cochrane's words 17 years later. So certainly others had developed epidemiological methods before, Frost, Greenwood, and many others, but Uses of Epidemiology was the first book of the discipline which put together these methods, addressed the issue of study design and different study designs, and set some fundamental principles. First, it was a book on non-communicable diseases and on descriptive epidemiology as a way to ask questions. Morris stated that in this book I'm concerned mainly with epidemiology as a way of learning, of asking questions, and getting answers that raise further questions. And the corollary was that epidemiology was also a method. The second point, disease is best conceptualized as a consequence of interaction between people and their environment. This is very constant in this book. And the third, epidemiology is an historical science, a population science, and a science fundamentally pragmatic and contextual in its orientation to causality. Epidemiology must engage with the jointly social and biological aspects of diseases, which is the health of the community. And I cannot think of a better definition of epidemiology, and maybe of medicine as well, jointly social and biological aspects of diseases. So that was the first book, and 3 years later, another book, which was a very important book for my generation, was the McMahon, Pugh, and Ibsen epidemiologic methods, which was later reissued as Epidemiology, Principles and Methods with Thomas Pugh only in 1970. And that is the book that I had to study. This was Brian McMahon sitting at his chair in the Department of Epidemiology at Harvard. And he was also a great man, very different from Jerry Morris. When you would talk with him, you wouldn't feel the passion, the social environment, the social concentration, the social aspect of epidemiology. Certainly Brian McMahon was a progressive and liberal man, but actually you didn't feel that political passion that was very typical of Jerry Morris. He was also British. He was educated in England. And not by chance, probably, his supervisor was a giant of demography and epidemiology of the 19th century, Thomas McCune. He then migrated to the United States in the 50s, got a Master of Science at Harvard, and then he became a United States citizen in 1962. From 1958 to 1988, he was the head of the Department of Epidemiology of the Harvard School of Public Health. And like Morris, he was one of the first to concentrate on chronic diseases when most epidemiologists would be students of infectious diseases. He pioneered studies on diet, on breast cancer, on passive smoking. And again, I think it is correct to say that his 1960 and 1970 books are universally recognized as the first books of modern epidemiology. With the book by Morris, even if the two books are again slightly different, the one by Brian McMahon is much more methodologically oriented. The same methods are in Morris, but the attitude of Morris was more to translate in public health, in prevention, what came from descriptive and analytical epidemiology, while Brian McMahon was mainly concentrated on method. And he did a good job with his book. So the books of McMahon and Morris have a part of methods and study design, But they also have a very large part on descriptive epidemiology as a way to see health problems to be addressed with descriptive and etiologic research. And I must say that you cannot find the same in books which came later. You cannot find the same in Rothman, for instance, which is a good book and which was also important for other generations. You cannot find it in the Lilienfelds. You cannot find it in Charlie Hanneken's and Julie Bering. So I think in one way these two books, the first two books of modern epidemiology, are unique because they still consider descriptive epidemiology as a very important part of the discipline. While later on, not to talk about the book of Miettinen, people were mostly concentrated on methods and maybe forgot a little bit about social medicine and prevention. So, for instance, the book by Brian McMahon has a lot of space devoted to time, person, place, and combinations of time, person, place. And it's interesting to look at the pictures at the slides from the 1960 and the 1970 edition, because even historically it's interesting to look at them. Here is age, and rates and numbers according to age. Here is the bimodal distribution of Hodgkin disease, which was described by Brian McMahon in one of his research work. Ethnic group, with the big difference in mortality between white and non-white, 3.8 increase with respect to tuberculosis and 3.3-fold increase for hypertensive heart disease in non-white versus white. Gender, and it's quite impressive to look at this slide because you can actually see that in 35 years, from 1933 to 1967, while the female mortality decreased enormously, overall mortality we are talking about now, the male mortality did not, and that was partly because of war, but not so much, because war had an impact on the United States population, but nothing compared to Russia or Germany or Japan or Poland. And this difference in the decrease of mortality between males and females and the ratio moving from 1.2 to 1.7 in 35 years is mainly due to the tobacco epidemics. Social status, with the 1.6 increase in mortality from professionals to unskilled workers. Place, Jon Snow and the Golden Square map. Time, again Jon Snow, and impressive rise of lung cancer. And also the combinations of person, place, and time, which was already a mixture of descriptive and etiologic etiologic, or at least it was a way to generate hypotheses to test in etiologic epidemiology. So here you have the strong decrease, threefold, for stomach cancer in the first United States-born Americans of Japanese ancestry, and the big increase 3 times in intestine. Or the application of the methods developed by Frost in the 20s to the tobacco epidemics, where the birth cohort approach shows that the plateau that you could see with age was not due to depletion of susceptibles, like it was hypothesized at the beginning, but simply to the fact that the younger cohort were not old enough to die of the lung cancer of smoking in their youth. And Brian McMahon died in 2007. And some of his students wrote this obituary in Cancer Causes and Control, and you can actually see some important names of epidemiologists. But I think that the most important point that these people pointed out was that Brian McMahon led the way for a school of epidemiologists who are now spread, they were said at that time, around the nation and the world. And I think that's really true. I mean, Brian McMahon had the capacity to attract many people, from Ken Rothman to Dimitrios Trikopoulos, Philip Cole, Walter Willett, Adami, etc., who either worked with him at Harvard or were trained at Harvard. And many European epidemiologists, from Jan van den Broeke to Bert Hoffman to Elio Rivoli, and many, many others, and many American epidemiologists, apart from these few names, originated from that school in that period of 30 years. So, to summarize my opinion about these two books, is that modern epidemiology starts with the books by Morris and McMahon, and if some epidemiologists born in the 40s and 50s did good things, it was because they were standing on the shoulders of giants. The same could be said by McMahon or Morris. I mean, without Thomas McCune, without Frost, I mean, probably they would not have been able to summarize the epidemiological knowledge in their books. But that is always true. And for instance, the idea that disease may be connected with a person's environment, which was a very, very strong statement in Morris and a strong statement in Brian McMahon as well, was expressed by Hippocrates almost 25 centuries ago in Airs, Waters, and Places. And if we read what Hippocrates wrote, and this is also at page 5 of Brian McMahon's book, Hippocrates said, whoever wishes to investigate medicine properly should proceed in this way. Look at the effects of seasons, winds, temperature, and the mode in which the inhabitants live, whether they are fond of drinking and eating to excess, or given to indolence, or fond of exercise and labor. Knowing these factors will help diagnose endemic diseases. Tobacco is missing, but you cannot blame Hippocrates for being born before America was discovered. And then he says, based on these data, individual cases must be evaluated. And as time passes, we will be able to say already at the beginning of the year how many diseases will affect the city. So the idea is that you can do prognosis of what will happen. Okay, the third book are really two books, even if probably the most important is Notes on Hospitals. And both of them were published in 1863 by Florence Nightingale, and they are full of very good, very nice tables which summarize statistics in hospitals and schools, native colonial schools. And if you're a fan of Florence Nightingale, as you should be, you can go to the memorial in Santa Croce in Florence, where when a memorial was built 3 years after his death. As you know, Florence Nightingale was born in Florence, and the name comes from that, just like the name of Parthenope. Her younger sister came because she was born in Naples. And we know that Florence Nightingale was the founder of modern nursing care. We know that she reformed the very configuration of hospitals and introduced the use of scientific evidence for healthcare, for healthcare interventions, which is not a little statement. And after traveling continental Europe, mainly Italy and Germany, to study nursing and hospital organization, Nightingale became the superintendent of a women's hospital in London in 1853. The following year, in the early month of the new Crimean War, the Times came out with a report which shocked the British opinion in England, and about the very difficult conditions in the British military hospital at Scutari near Istanbul. And the Secretary of War asked Florence Nightingale to take nurses out there and to superintend improvements. Not only Florence Nightingale was a great nurse who actually created the discipline of nursing, but she was also one of the first female statisticians. She developed an early passion for statistics, even as a child. She was collecting shells on Italian shores and making tables and very detailed card classifying them. She was homeschooled by her father, as it was customary for wealthy, high-class, educated families who would take the great tour to Italy. But she insisted to learn mathematics from a mathematician. And she also realized that knowing numbers alone had limited persuasive powers, and used her skill in statistical communication a few times to convince the British Parliament of the need to act in reorganizing hospitals, and especially military hospitals. She used hundreds of dry tables that the statisticians use in the two books we saw before, but this time she avoided to use them and instead devised novel graphs to illustrate the impact of hospital and nursing practice reform on army mortality. And this is one of the graphs she sent in the 50s to the Parliament. And this morning we had a lecture on attributable risk, and you can actually see how she was very good in describing what was avoidable. Of course, all these deaths were avoidable with no war, but she pointed out how the blue color indicated deaths from somehow preventable diseases. The red part was death due to wounds, and the black part was mortality due to other causes, mainly in the battlefield. So she pointed out how both in 55 and in 56, most of the mortality came from avoidable mortality if the hospital would have been run differently and if prevention could have been done on the diseases. And this is the document with the signature of Florence, Florence Nightingale, when she was the first woman to be admitted to the Royal Statistical Society. So, was she an epidemiologist? I mean, this is a silly question, and it is certainly not the right question. We cannot attribute to Hippocrates or Florence Nightingale or people who lived centuries ago things that they couldn't be. More important, she was a public health giant, translating scientific evidence in healthcare interventions, and she was a great statistician. She was a great statistician. A great statistician, and I think that is enough. The fourth book brings us back to Italy, and to the 17th century. Who was Bernardino Ramazzini? Well, he is universally recognized as the father of occupational medicine, and this is a statue of the Occupational Health Institute of Kitakyushu, I think is the name of the Japanese place and university where the statue was built in his honor. This is the book for which he is most famous, which was published in Modena in 1700, Diseases of Workers, or the Morbus Artificum Diatriba. But he was, first of all, a great physician for his times. He was one of the first to support the quinine-rich bark against malaria. He cited quinine did for medicine what gunpowder did for war, and he was also very specific on the use of quinine in malaria and not in other affections. He was very skeptical on bloodletting when bloodletting was the art of medicine, decades before Pierre-Louis did his trial in 1836. He was the first one to note that nuns develop breast cancer to a higher rate than married women due to the instability, he said, of the natural lack of sexual activity. It was not easy to say this in Italy 60 years after Galileo trial. He wrote quite a few orazioni, as they were called at that time. We would call them articles today, where he was very clear. For instance, at a certain point he said about sedentary life, sitting can lead to an early death. He proposed that physicians should extend the list of questions that Hippocrates recommended, and they should ask their patients, what is your occupation? He was very much against religious and scientific dogmatism. He had a very powerful and critic orazione against the church that, according to him, gave more importance to morality than to preventive medicine, than to preventive diseases through hygiene by closing the public baths. And again, it was not easy to write a full article against the decision of the church in those days. And if you are a capitalist or a Marxian, you might be happy to know that both Karl Marx and Adam Smith cited him in their most important works. Was he a precursor of epidemiology? Again, a silly question, in my opinion. Certainly we can say that there was a strong epidemiological approach in the 5 yearly books that he published, the Costituzioni Epidemiche, from 1690 to 1694, where following Girolamo Fracastoro and the book he had published in Verona in 1546, he linked again annual health statistics of infectious diseases to environment, and you can say this was an epidemiological approach. He had very strong statements on prevention rather than cure in all his work. Maybe that is a public health approach, but for instance, he noted that not only in antiquity, but in our own times, 1700, also laws have been passed to secure good conditions to workers. So the art of medicine should contribute its portion for the benefit and relief for whom the law has shown such foresight. He is universally, I would say, recognized as the founder of occupational medicine for his book, where in the first edition and in the second editions edited in Padua in 1713, 54 chapters on different 54 occupations were published. Looking at the population of workers, a link to disease and mortality, and even more important, to the technology of the time. Ramazzini was not a man who would sit in his university chair. He would go actually to the factory, to the mines, to see what was happening and what was the state of the art of the technology and why workers would become sick. His book had His book had an enormous diffusion immediately. In 1705, it had been translated by Leibniz in Leipzig. It was immediately translated in London 5 years later, and all over Europe. These are the chapters of his books. And looking at this syllabus, you might think that the book is really heavy for occupational clinicians of 1700, but actually it's a very nice, very enjoyable book. Let's just take only diseases of the miners, which is the first chapter of the book. And the number of citations, 9 citations by the way, is really impressive, both from the old times, from Hippocrates to Saint Cyprian, who before being martyrized, wrote a letter to the bishop saying that if the Christians were put in gold mines to die very quickly, that was not a problem, because the real gold of the mine was the gold of Christ and of the Christians who were there. And then there is a huge number of citations of mainly, of only Italian and German scientists, and all of these citations are related to citations of miners, so they are very appropriate. And the fact that the modern citations were only from Germany and Italy shows that in that historical period the major scientific and academic contacts were between the German states and the Italian states. let us just take one citation of Ovid from his book. And Ovid wrote, "Men go down into the bowels of the earth, and what she has hidden away and consigned to the Stygian shades, they dig out, wealth, provocative of evils." And Ramazzini immediately acknowledges that Ovid was referring to moral evils, but argues that some statements could be applied to the evils that attacks men's bodies. And then a long list of these diseases, etc., and that the lungs and brain of workers are badly affected, the lungs especially. Or even more interesting, because it is an anti-academic citation, is the citation of Galen. And he says, "Many of our own clinicians would laugh at any professor if they saw him descending to explore regions underground as to investigate the hidden recesses of nature. But let them learn from Galen, who went down to a depth of about 1/8 of a mile and observed the green water dipping into a pool of a suffocating and almost intolerable odor. Probably it was a ferrous sulfate cave mine. Workmen hastily carrying out this acidic water. Probably it was not workmen, it was slaves. And probably Galen didn't worry that much about the health of the slaves, because he was a man of his time. But certainly Galen is cited here because Ramazzini did exactly the same thing. He was actually going into the places where the people worked, and he was very critical of the academics who would not move from their office and their chair. Was he an environmental epidemiologist? There was a recent article in the Journal of the Italian Epidemiological Association suggesting that he should be cited as the first environmental epidemiologist. Again, it's a silly question. I don't think I would be critical of that approach, but certainly we know that he was involved in the first trial, to my knowledge at least, on mercury sublimate and environmental pollution in Finale Emilia in 1686. And to show the big international scientific connections between the German states and Italian states in that period, Leibniz was also involved for courtesy as a good friend of Ramazzini in the same trial. Unfortunately, the trial didn't go well, and the Saffardi family, who was polluting the Finale Emilia territory, went absolved. Probably the importance of industry in that area was more important than the worth of Leibniz or Ramazzini. Okay, so we finished the 4 books, but there is one more book that I would like to to cite out of the 4. Well, we all know Chekhov, and Chekhov wrote in 1893 a very interesting book, a non-fiction book. This is the English edition when it was translated from Russian in 1967, but Chekhov is not depicted very well, not too colorful, not too smiling, so I preferred to put also the Italian edition. And the Italian edition is important because, to my knowledge, it is also, it's a recent edition of 2 years ago. It is the first edition, at least in the Western world, which puts together also the pictures that Pavlovsky, a friend of Chekhov that he met in Sakhalin, sent to him after he had left the penal colony. And here you can see the coal mine. In the previous picture, the pier where the coal was shipped. And then political and non-political convicts. So we know, well, Anton Chekhov doesn't need a presentation. We know that he was a great doctor and a great novelist and playwright. And he always said that he had two passions in life: medicine first, and the literature second. But there is one question that I don't think has been answered yet, and it is why would a very famous writer at age of 30, at the height of his fame, go to Siberia, to the penal colony on Sakhalin Island, where he spent 3 months, and this is where epidemiology or quantitative methods could come in, where he spent 3 months interviewing more than 10,000 of convicts, natives, and settlers for a census he had decided and carried out. Maybe it was because his brother had just died. Maybe he felt he had to do something important. He was a very progressive and anti-Tsarist intellectuals, as most of the intellectuals of his days. And what he saw in Sakhalin shocked and angered him a lot. And that is very clearly expressed in his book, The Island of Sakhalin, we were talking about. And my opinion is that his book is a beautiful work of social science, of medicine, and of literature. It's a non-fiction work with a great emphasis on demography, morbidity, mortality statistics, carried out with the method of a scientist. This is the card that he designed himself, very simple, but he filled in more, more than 10,000 cards over a period of 3 months, which is more than 100 cards a day. Probably the response rate was 100% because the political convicts knew who he was, and the non-political convicts probably thought it was good to answer, was good for you to answer to an educated, well-dressed man coming from Moscow. And the book is really interesting because it starts with a short geography of Siberia, then it talks about the census, the contents of the statistical form, and then it's almost an obsessive repetition, but very, very beautiful, of numbers, of statistics on the Gilyaks, the native population, the Russian settlers, the convict population, the escapees. For instance, the chapter on escapees is really very interesting because not only he used the time to fill the forms and the cards for the census, but he did speak a lot of time with the officers, with the people there, and he got very detailed statistics about the number of people who had escaped, how many people were brought back, how many people were killed, how many people didn't come back, and even made probabilities by himself about how many of these could be still alive and living in Siberia or maybe in other regions of Russia. And he gives very detailed numerical compositions regarding age, gender, marriages, birth rate. So it's really a very, very medical organization. It's a very interesting quantitative book, a non-fiction book. And I'm not the only fan of Sakhalin Island, because Sharma Kil in the New Yorker, in an article entitled Chekhov's Beautiful Nonfiction, says that, sorry, as I talk I get more cough, but we are almost at the end. She says, or he says maybe, the reason Sakhalin Island is the greatest work of journalism for the 19th century is that, unlike other major journalistic works from that period, for example, from the Crimean War, the book has not aged. Chekhov's articles are mostly about closely observed humanity. And if you know Svetlana Alexievich, who is also a great journalist, a non-fiction writer, who got the Nobel Prize in Literature in 2014, she got the prize because of her polyphonic writings. A monument to suffering and courage in our time. And the book of Svetlana Alexievich and the Nobel Prize reason for giving the Nobel Prize reminded me very much of the Sakhalin Island. So, these are the 4 books with the bibliographic references in English. And if you want to say that there are 2 more books which can be considered as suggested readings. So, thank you to you all, and thanks to Franco Carnevale, David Kriebel, Neil Pierce, and Margaret Quinn for useful discussion and suggestions. Thank you very much.